Hi, everyone. So my name is Yasmeen, but I'm an associate professor and consultant at Mayo Clinic here in Arizona. So I just sort of hopped over to talk to you guys. I'm a thoracic pathologist, so I do heart and lung pathology. And I'm going to talk to you about the role of tissue biopsy. So step one of getting a diagnosis, and then I'll pass it off to my colleagues who I'll introduce before they give their talks. So I have nothing to disclose. So the learning objectives for this brief intro here is just to be able to recognize amyloid on biopsies from the heart and the lung. And this is a cardiac conference, but I'm also a pulmonary pathologist, so I'm going to show you a little bit of lung. Talking about the histologic differential of amyloid. So it's not always super straightforward. And then at the end, we'll briefly touch on light chain deposition disease and how you might differentiate that from amyloidosis. So you think, okay, diagnosing amyloid is really easy, right? Well, actually, not necessarily. It often might be an unexpected finding. You have to think about it to see it, right? It can be in any organ or tissue. And even if you do suspect amyloid, the actual findings can be very, very subtle, and there are mimics to amyloid. There are multiple modalities available for typing, and then special stain interpretation here can be challenging. Dr. McPhail will be talking to you about typing later. So the classic stain that you've probably all heard of is Congo red. And if not, you'll have heard of it in this talk. So Congo red is in the upper left-hand corner here. Let's see, I don't know if this laser, no, I don't think the laser works. That's okay. In the upper left-hand corner is a Congo red stain. So we look for two things when we interpret this special stain. First of which, we're looking for congophilic tissue. So it basically means it's kind of a red-pink color. And then when we polarize it, so it basically changes the light source, we're looking for apple green birefringence under cross-polarized light. And that's that upper right-hand corner photo where you can see that sort of bright green color. There are other stains that we can use to assess for amyloid, including sulfated Alcium blue, which gives this very beautiful teal green color. It's almost like a toothpaste color. And then under trichrome, which is a stain we use usually to look for just fibrosis in general, amyloid will be sort of a gray blue color. And that's that lower right-hand box right there. So Congo red is considered the gold standard for identifying the presence of amyloid in tissue. It can be a technically challenging stain. As I mentioned, it's a special stain, meaning it's not necessarily automated, can be manual or even partially manual for the technicians to do this stain. It does require a thicker cut sections, 8 to 10 micrometers, so you can't use pre-cut slides. You can't guarantee your results with pre-cut slides, that is. You can have false positives and false negatives with amyloid. You do need a polarizer, and you do need experience looking at polarized tissue. So it's not uncommon for us to see in our consultative practice cases come through, whether they're in the heart or the lung or elsewhere, question mark amyloid, essentially. There are some rare non-specific things that will stain with Congo red, like fibrillary glomerulonephritis in the kidney, but we won't get into that here. So let's think about this diagnostic problem. So from a pathology perspective, we're looking at tissue, right? So we have this light pink mass. It's not very cellular, and it's not a cancer, right? So these are all things that one of these is amyloid and the other three are not. So there's a lot of mimics of amyloid. So if you look in the upper left-hand corner, you see this kind of light pink material. And if I showed you that photo and said, well, that's amyloid, you'd probably all nod and say, oh, yeah, that's amyloid. So what that actually is necrosis in the upper left-hand corner. So lots of mimics, right? And then if you look in the upper right-hand corner there, so that's actually a piece of lung in the upper right-hand corner. All those little empty spaces is where air would normally be. You can see there's this bright pink material in the interstitium. So that's actually fibrosis. And then in the bottom left-hand corner here, you can see there's some pink material kind of in the center forming a little glob. That's actually amyloid. And then in the bottom right-hand corner, that bright pink material, which could also be amyloid, is actually something called light chain deposition disease. So you can see all of these mimics of actual amyloid. And so you need to be, one, thinking about amyloid to run that Congo red stain to then push it forward, and also be willing to recognize those mimics there. All right, so let's talk about the heart. So cardiac involvement is very important for overall prognosis of patients with amyloidosis, and there's many different types that can be found in the heart. We're not going to go into a lot of detail with that here, but let's look at an example. So this is an endomyocardial biopsy, and in the inset in the bottom right, that's what normal myocardium should look like, okay? And then if you look at the large piece of tissue that you can see, there's quite a bit of lighter pink material. So the brighter pink sort of circles that you're seeing there with the dark little blue dots inside, those are the myocytes. And then what you're seeing elsewhere is all just amyloid that is actually just pushing the myocytes aside, right? So you can imagine why it would be challenging for the heart to contract when you have all this inert material pushing and replacing those myocytes. This is a Congo red stain from the same tissue. So you see that nice pink material there that's staining. So that's that Congophilia. And then if we hit our polarizer, again, you see that apple green birefringence. All right, so this is positive for amyloid deposition. There's that sulfated Alcium blue that gives you that very, very bright teal color. So sometimes when you have very focal amyloid that it may be difficult to identify on the Congo red, the sulfated Alcium blue can be helpful because it's a much more obvious color to see, and it can nicely highlight overall distribution, especially in subtle cases. This would not qualify as a subtle case. All right, so you have the amyloid, now what? All right, so there's lots of tools for typing. There are a lot of different methods, including immunohistochemistry and immunofluorescence and electron microscopy. None of those are as robust as what is considered the gold standard, which is mass spectrometry, which my colleague will talk about after this intro lecture here. All right, so this particular case turned out to be ATTR, transthyretin type, and the patient subsequently had to undergo a heart transplant. So this is what the heart looked like after the patient's transplant. And as you can see, this is a cross section here along the short axis, and it doesn't look overtly abnormal, maybe a little bit of thickening in the wall, but there's no obvious, like if you're looking for an infarction, you might see a large area of discoloration or something along those lines. This looks almost normal, but just a little bit thick. So if we take a section from the heart, and this is again from that same patient, you can see the papillary muscles there on the left, and then you see how there's kind of a variation in the color. It looks almost mottled, right? So the darker pink areas are the benign, or I shouldn't say it's all benign, but the darker pink areas are the normal myocytes, and then the lighter pink is all of that amyloid displacing everywhere. So you can see how the amyloid in this patient was displacing all of these myocytes and causing a very firm and stiff heart, so it doesn't contract well. And then here's a little bit higher power. Again, that light pink area, it's all amyloid. It has almost like a cracked appearance to it. So let's quickly move to another organ. Let's look at an example of the lung. This is a patient that had multiple bilateral lung nodules. So the sort of amorphous pink material, a little bit of lung on the left with some chronic inflammation. So we have that same differential. All right, and we do our special stains. We, of course, will look for any evidence of infection. If you're considering necrosis, you have to think about infection. We do our Congo red and our sulfated Alcium blue. Here's our sulfated Alcium blue, nicely highlighting the areas in this teal color. And there's our Congo red. Flip our polarizer, and you can see that nice apple green birefringence. Very classic with very rare exceptions. This is pathognomonic for what we see in amyloid deposition. So this particular patient had an underlying indolent B-cell lymphoma. It was an AL kappa type amyloid. This was a nodular pulmonary amyloidosis. So I won't go into too much detail here, but there are a lot of different types of amyloid deposition that you can see in the lung with varying differentials for them. So let's look at another presentation. So this was a patient with a 73-year-old man. He had increasing shortness of breath, and he ended up having an amyloid biopsy. So this is from that same case I showed you as part of our differential. So this is almost normal lung. You can see there's some empty spaces where the air would be, but then there's this kind of pinkish material that's edging around, and it's very, very subtle and easily missed on low power. But the sulfated Alcium blue highlights this amyloid very well in the interstitium in that kind of teal toothpaste color. Here's the Congo red, and then again, that polarization. So this is a good example of how even when you have quite a bit of amyloid in the interstitium, and you can notice this in endomyocardial biopsies as well, not every area that's congophilic will actually show you that apple green birefringence. So if you have small amounts of tissue, that can contribute to the challenges in catching those diagnoses. All right, and this patient actually also had ATTR type cardiac amyloidosis that had been previously diagnosed. And so this was consistent with additional systemic involvement. So I'll end here with a rare differential. This was a lung nodule in a 78-year-old man. So again, bright pink material. There's a giant cell up there. You can see giant cell as a reaction to amyloid as well as to this. But the Congo red wasn't particularly congophilic, and nothing was showed up on the polarizer. So the material kind of looked like amyloid, but the Congo red was negative. This is actually a fairly common differential that comes up in our consultative practice. We can run an additional special stain here. So this is that sulfated Alcium blue. So we're not seeing that toothpaste color, right? We're again seeing kind of this salmon pink color. This is a trichrome stain. It's not giving you the blue color, right? It's looking bright red. So this is actually an example of light chain deposition disease. So this is a non-amyloidogenic monoclonal immunoglobulin deposition disease. You can have systemic forms, or you can have isolated involvement, like this particular case in the lung. They tend to do better with the isolated version. Systemic, which can be in the heart, tend to have a more progressive course. So this is a nice little handy table on differentiating between amyloid and light chain deposition. It's also helpful when you do send for typing afterwards to go ahead and let the folks know that you're thinking about light chain deposition, but you can see there's quite a stark difference in the colors on these special stains. All right, so that was a very short intro to tissue biopsy diagnosis, and we can take questions at the end.